Good morning. Welcome to Virtual Voices. I'm Elizabeth Pruch. I have the honor of helping to ensure our alumni stay engaged. Through COVID, through every important issue that our community is facing, we want to just make sure you guys continue to have opportunities to connect with each other, continue to learn. And this is why Virtual Voices was started. It initially started ensuring that we had a place for our alumni who are on the front lines of impacted industries to come and talk about lessons learned through this pandemic. We've shifted, adjusted, we've brought in a lot of amazing speakers on wonderful topics, ranging from events and hospitality to storytelling will be next week. Today we're focusing on disparities surrounding COVID. This couldn't be a more important topic. It always has been. We've had this on the calendar for over a month now. And with the recent events that have happened in our world, it's certainly an important topic right now. I think the important thing for us to note, and as I was preparing with our speakers today, it's that disparities surrounding COVID have really been magnified. We knew that they've always been here. We knew that they were here. When COVID hit, it was all magnified. And what we're looking at are systematic barriers to people of color and communities that don't have the same kind of access. Again, a topic that's incredibly important right now. So I want to jump right in so we have time for our amazing speakers to really be able to give you some information around what they've seen, what they're learning, what they're hearing, specifically to COVID, but also if you have other questions, we do want to hear from you. All in all, I am going to first start with reading some bios of our speakers. We are incredibly honored to have, oh, I'm sorry, I keep forgetting this part of it. Some housekeeping pieces and just some Zoom reminders. This session will be recorded and we will email it out to everybody afterwards so that you have access to this if you want to listen to it again or share it. We do ask that everybody stays on mute. We are going to be managing the Q&A through the chat feature. So feel free to open up your chat. If you have a question, type it in there and then I will call on you to unmute and you can ask that out loud and ask your question. If you prefer not to ask it out loud, I'm happy to do that for you, but please let us know. We do suggest that you switch to speaker view. It's just a little bit easier to see who's speaking. You can find that in the upper right-hand corner. I'm sure we're all very well versed in this by now. And then if you need any help at all, Megan Vivier, who is managing this call for us, you can reach out to her technically for any technical assistance through the private chat. Thank you, Megan, for always making us look good. And a huge thank you to our sponsors. You know, these three companies, Molson Coors, Southwest Airlines, and TIAA, have really cared a lot about how we give back to our community, how our alumni stay engaged. They care deeply about it and they see the importance. Molson Coors has been a true partner for many years. And we're always happy to cheers with their beer at any function we have. And one day we'll be able to do that again in person. Southwest, a truly tremendous partner. They care deeply about their community. And we've seen that so many ways here in Denver. And we're very lucky that they have a presence in Colorado. And then TIAA, who really just steps up and cares a lot about leadership. And they understand that what we're doing is really important work right now. And so they invest in us financially, but also with their team being connected to us. So thank you to our sponsors. We really appreciate all of you very much. Okay, now I get to talk about our speakers. I'm very excited and we're very honored to have these amazing folks with us today. I'm gonna read a short bio for each and then we're gonna jump right in with some questions for each of them. Denise Mays is the Public Policy Director of the ACLU of Colorado. In this role, she oversees all the legislative work that affects civil liberties at the state and local level. Here's the kicker. She's the primary person overseeing all legislative initiatives at the state during legislative session, which we are in right now. She just let us know she was there until 12:30 this morning. So we are incredibly honored you're here with us. Thank you so much. Before she was at the ACLU, Denise was the Director of Operations for Vice President Joe Biden. She also served as General Counsel for the Office of Administration under President Barack Obama, where she managed White House contracts and personnel issues. She is just a force, and we are so thrilled to have you here, Denise. Thank you for being with us.
Absolutely, thank you.
Next is Carlos Martinez. Mr. Martinez is the President, CEO of the Latino Community Foundation of Colorado, a position he's had since January of 2014. He directs efforts to expand philanthropy by Latinos, advance the foundation's vision of building the civic power of Latinos in Colorado, and oversees the foundation's work in building a vibrant narrative for the Latino community of Colorado. He's currently the president of the Denver Public Library Commission and a board member of the Colorado Health Foundation, the Scientific and Cultural Facilities District, the Grant Makers Concern for Immigrant and Refugees, and the Latino Cultural and Arts Center. I'm not sure when you find time to do anything else, sir, but thank you for giving so much to our community. Much appreciated. Next is Dr. Darlene Sampson. Dr. Darlene Sampson lives by her late parents' mantra. I love this mantra. Giving back to others is in your DNA. You must respect and honor the shoulders you have stood on. With that thinking in mind, she has maintained a space of social justice and cultural humility as she works across the education and social work fields as an administrator, leader, and equity specialist. She's a licensed clinical social worker, has a master's degree in social work, and also earned a PhD in educational leadership with an emphasis on cultural responsive pedagogy. That is impressive. We have a lot to learn from you today, and I'm so thrilled to have your expertise and just your perspective on this call, Darlene. Thank you for joining us.
Thank you for having me.
Absolutely. And I love your background. I've said this, very vibrant. And Dr. Reginald Washington. Dr. Washington is a second-generation Colorado native, that's amazing, and has practiced medicine in the state for 39 years. He studied and published peer-reviewed articles regarding the prevention of cardiovascular disease and obesity, especially in minority populations and children. He's currently the Chief Medical Officer at Presbyterian St. Luke's Medical Center and the Rocky Mountain Hospital for Children. Dr. Washington, thank you so much for giving time to us. We really appreciate it. I know you have a lot on your plate as well, so thank you very much.
Thank you. Thank you.
All right, we're going to start with you, Dr. Washington. How is COVID impacting different groups in different ways? And what are the social determinations of COVID? Open this up for us if you could.
Thank you for the question. And I'd like to first of all thank the Chamber for convening this group. And I'm proud to serve on a panel with such knowledgeable folks. And I hope this next 60 minutes is very rewarding to all. I'm very briefly going to talk about the social determinants of health. Most everyone knows about those to some degree. But I'm also going to share with you a little bit about the social determinants of COVID health because they're a bit different. And then I want to review what is known about the biology of the COVID virus and how it has affected all communities, but particularly minority communities. And then I'll finally, with my few minutes remaining, tie all of that together. So let's begin with the social determinants of health. They are not new. As you'll hear from the other panelists, social determinants of health have been around for quite some time. We've done a very poor job, relatively speaking, of solving the social determinants of health. But as you will find out through the course of this presentation, COVID has exposed or re-exposed the social determinants of health in a very dramatic way. So depending on where you live, how you travel, what your employment status is, what your educational status might be, the safety of moving about in your community, all of those things are very dramatically impacted by COVID, as we will find out as time goes on. There's some very specific social determinants of COVID, however, that are very fascinating as well as very concerning. For example, we know that the COVID virus is extremely contagious. And because of that, social distancing has become a very important measure to limit the spread of the COVID virus. However, if you live in crowded housing, if you live in one of the poor economic neighborhoods so that you can't afford not to go to work, you can't afford not to take public transportation, you can't afford to shop in markets that are not necessarily socially distancing or requiring masking, all of those things have a particular impact on the COVID virus, and again have revealed nothing new, but have emphasized the things that impact social determinants of health. As far as the medical system is concerned, one of the things that medicine needs to do a better job of as a discipline is taking care of the global social determinants of health as opposed to just the clinical ones. Hospitals pay a lot of attention to readmissions, using the emergency room as a primary care provider. Those are all reflections of the social determinants of health, but they have an impact on the COVID virus because we know patients usually of color don't go to the hospital as readily or as soon. They usually show up when they're sicker. The number of patients who are intubated almost immediately upon presentation to the emergency room are much greater in minority populations because they delay their health care. And we don't have a lot of time to describe why that is, but it's very important. When we look at the biology of COVID, several things are revealed. First of all, I would like to tell everybody on this call that COVID as a virus is not racist. So when we start talking about why COVID is impacting different groups, it's not because of COVID, it's because of what COVID has been allowed to do. So let me explain to you what I mean by that. First of all, everyone needs to understand that we're just now learning more and more about the COVID virus. It's only been around in human beings for 6 to 9 months. That's not very long. But people get very impatient when medicine can't describe all the nuances of the COVID virus. Let me tell you what we know so far, and this is just a partial list. We know that some people can have the COVID virus and have absolutely no symptoms whatsoever. We know other people can get the COVID virus and die very quickly. We're just now beginning to understand why that might be. We know, for example, that COVID in some patients, it elicits a very reactive and very dangerous hyperinflammatory response. And now we're learning that people who are very sensitive to this inflammatory response get much sicker. We know diabetes. People who are diabetics do not do well with the COVID virus. People who are obese do not do well with the COVID virus. People with chronic lung disease, asthma, or smokers do not do well with the COVID virus. We also know that the elderly don't do as well, partially because they have some of these pre-existing conditions, but also their immune system may not have seen viruses that are related to the COVID, so they don't fight it as well. And also they can't necessarily socially distance, particularly if you're in a nursing home or a prison. So there are a lot of biological reasons why COVID may affect some people differently than others. Now, let me try to put all that together. We do know that the life expectancy of certain populations is less than others. We know that if you're a Black male, you're not going to live as long as other groups. We also know that certain groups have a much higher incidence of these comorbid conditions, such as congestive heart failure, diabetes, obesity. And we know that affects the Black population and some Hispanic populations more than others. So if you put all of that together, if you have the social determinants of health, you have the social determinants of COVID, you have more of these pre-existing conditions, it's no surprise that certain populations are impacted more by COVID than others. So I think I could go on and on, but I think I'll conclude my comments for now with that.
Thank you, Reggie. There'll be a lot of time for questions. I think a few things struck me. You know, this virus isn't racist, but some of the systems we have in place are making it harder to understand why that's happening. And, you know, we will get to a point where Dr. Washington can let us know what we can do. We'll ask that at the end. So thank you for sharing that. That was very useful knowledge, I think, to go into this.
Thank you.
Dr. Sampson, I want to go to you next. In some of our lead-up calls to this, we've talked about several different focus areas around what's going on right now. There's the equity, there's health, there's mental wellness, and our community. These are focus areas right now for a lot of people. Talk to me about the differences of these and why each of these is so important right now.
Okay, so I really want to follow up with what Dr. Washington said as well. A lot of the health determinants, social determinants are really social ills. And we have to talk about that because we are in the twin pandemic of racism, oppression, and health disparities. So we have to pull those all together to understand that a lot of the reasons why we are here today is because of these issues started to implode. They were together before, and we've talked about them for a long time, but we didn't know how to address some of these health disparities. So there's a great wake-up call that I want to acknowledge because of the number of people that have been lost to the COVID-19 virus in all across this nation, Black and brown, everyone. But we have to talk about specifically what happened and how did some of the determinants that I will call systemic determinants impact particularly Black and brown communities and devastated Black and brown communities. So this wake-up call is amazing right now, and it's seen across the country. the protests, the push for differences, the push to recognize that Black Lives Matter. This is so imperative. And so we can no longer push the snooze button on the wake-up call. We are there now. And so we're going to have to look closely at what is occurring. And so how I look at it, I look at mental wellness as health, but I also look at it as housing and mental health and socioeconomic status and the educational system. I want to look at it more broadly because all of these are impacted not only by the pandemic of racism and health, but all of these are interlocking. They're all intersectional. So as we talk about wellness, we want to talk about it in a more broader perspective because there is a great deal of trauma that is going on right now, particularly in Black and brown communities, and people don't want to talk about it or they haven't felt comfortable. So for instance, if you go to the doctor and you want to talk to him, and this has happened to me as a Black woman, I've gone to the doctor and really what I was dealing with is stress at work, racism, microaggressions, oppression. But yet, as I went to talk about my blood pressure or how I was feeling, I don't think I've ever in the 100 years that I've been on this earth heard anyone say, how does it feel to walk in your shoes? What is it that you need? How can I support you? And so I want to talk about each of those areas as we think about who were presented at hospitals, what kind of care they received, how many times they may have been sent away, what was their economic status? Were they a bus driver, a store clerk on the front line? Who are these individuals that have passed away or are COVID positive? And what were the systemic barriers and oppression that they may have dealt with? So I really look at it in sort of a table. So we have the social determinants that Dr. Washington talked about. I put those on the right. On the left of that table, I talk about the systemic issues that make the right side implode. And that's the part that I really want to focus on is wellness is larger than even greater than the determinants of health, because what happens when people don't get their needs met? What happened when people's health needs are not consistently cared for? What happens when they don't get the social services that they need? That there are services that are culturally responsive and caring about the environments that people are in. So that's what I mean by imploding. These are always been there, and we have always talked about them for a long time, but we haven't been very good at addressing them and then understanding them with empathy. What happens to people as they walk this earth, and what are the occurrences that nobody knows about in healthcare, in mental wellness? So we've got to talk about racism. We've got to talk about oppression. And then we have to talk about that left side, housing, healthcare, access from the time we're born to the time we leave this earth. These are the kind of things we're going to have to talk about. And finally, I really think that the COVID-19 pandemic has taught us a lot. And I think we need to look at racism in that way. So what I mean is, if we treated racism like we think about COVID-19, that means that we will listen to the experts, be quiet and listen to what people who are dealing with this have to say about what's going on. We'll keep our minds and hearts open to what people are really dealing with. And so some of these lessons that are over here with COVID-19 can apply to racism. You got to get help. We have to ask for support for the kind of things that we need. So if we can look broadly, we have the determinants, but we don't want to medicalize everything because we know that housing impacts health. We know that economics impact health. We know that food scarcity impacts health. We know that when we have heart disease, what were the ways of eat? So we're not just going to talk about how people eat. Oh, they exercise. Oh, that group was obese. What happened? What were some of the other extenuating factors that impacted how, what happened in terms of the disparities? And so that's the lens that I want to leave you with. I
love that, Dr. Sampson. I think a lot of what you're saying is how important it is for us to educate ourselves and each other on really what's happening and really where this began and how to break free from it. So thank you. That's great. We're going to get to more questions here. Skip, I see your question. I am going to get to that. I want to move quickly to Denise. You know, you were recently appointed to the governor's health equity response team. What are you all focusing on, and what kind of steps are being taken to ensure equity right now?
Good question. You know, it's interesting that I think that the predominant theme of at least the last couple of folks who are speaking, and really how you introduced the program is and this is the theme, I think, of or what a lot of people took to the equity task force, and that is that the virus itself may not be racist, but it sure reveals a history of racism. And it's not like, you know, African Americans and Latinos are not somehow miraculously more predisposed to the virus than their white counterparts. But the fact of the matter is that it is all of these inequities that have been driven by generations of institutionalized barriers to medical care, to healthy food, safe and stable housing, clean air, education, and reliable transportation. And it's not very different than the things that we've already heard. And so I think on the Equity Task Force, what we're trying to look at is not just the technical, literal sense of physical health, but rather what are all the things that can make up or create a healthy community. So one of the things that we have probably short-term focus, long-term focus, but short-term focus is what can we do in the legislature now. And some of these things are actually moving. For example, there is a move to have some sort of eviction protection. And this is something that we're going to see primarily African American and Latinos will also suffer from this. Probably about in 2015, the ACLU did a study about those individuals that are more susceptible to eviction. And in Colorado, what we discovered was that African American women are more subject to eviction than their white counterparts, or frankly, any other community of color. So we know that they're at serious risk in this instance too. They're the ones that are maybe more apt to have lost their jobs. They're the ones that are the small business owners that they may no longer be able to move forward. And so there is already a bill working through the state legislature on that front. The other area that the Equity Task Force is working on with respect to legislation is whistleblower protection. And I think what we found throughout the time of the quarantine, the stay-at-home orders, when individuals were going to work, and again, these are the essential jobs that some of us may take for granted. You know, your home healthcare worker, your grocery store worker, your food prepper at our local restaurants who are still doing carry out and curbside delivery. And so what we wanted to do was be able to give an avenue for those individuals to be able to report certain inequities, abuses, just issues with their employer and not suffer any sort of repercussion. So that's also a piece of legislation that is moving. There's also a call, and there is again legislation moving on this front to expand workers' compensation. And so that is also moving. And you can see how all of these areas tie in to a healthy community, even though they're not necessarily per se physical health, although those are certainly important as well. And those are kind of the other pieces that we're working through on the Equity Committee is that have nothing to do with the legislature. It's how do we reach the communities that are the most impacted? How do we make sure that they are caring for themselves and that there are the safety nets in place to help them do that? So a lot of the free testing now is going on in Denver, and that's expanding in the metro area. There's also a call for how do we get communities of color to take advantage of those things, and a lot of it has to do with the messenger. The notion that the Colorado Department of Public Health and Environment can put it on their website is not as very helpful. It doesn't reach the communities you really want to reach. And so there's a real push for having the right messengers deliver the right message to the right communities, and there's a real push for that. There's actually going to be a meeting tomorrow with some members of the Equity Task Force, me included, with the governor to talk not only about where are we on the legislation and do you support it and can we look for your help there, but also where's your department going to be on carrying some of these initiatives forward? And I think that's just, that's kind of a broad brush, but that's basically where we are. And just to put a finer point on it, sometimes data is really good to educate us, and other times it just confirms what we already knew. And there was a lot of people in the community that started saying day 1 or day 2 after the first confirmed virus on March 5th here in the state of Colorado that we all suspected, somehow knew that communities of color would be far more severely impacted. And indeed, fast forward 5 weeks later, when the governor finally instructed the Colorado Department of Health and Environment to collect that data, it in fact confirmed what we already knew. And I'm happy that this equity task force is taking some of these issues seriously, and we'll continue to move our efforts forward.
I'm so glad that's happening, and while maybe at a different pace, I think it's good that it's happening, and I'm glad you're on that. I did hear a statement recently that Governor Polis is doing free testing for anybody that has been to the protests. Do you know that answer? And then I'll keep talking.
I haven't heard that the governor is doing it, but I have heard that the mayor is doing it.
Okay.
So I think it's more Denver focused than outside of the metro area. At least that's what I know.
Interesting. We'll do some fact checking on that. Thank you.
There you go.
There we go. Carlos, I want to move on to you, and then we're going to open it up for bigger questions from others if you have them. But Carlos, you've told me a statement that struck me. You've said quarantine is a privilege. Can you tell me more about why that is and what you've been seeing in your community?
Sure. And I'm going to start off by saying that because of the many structures and systems that we have in place that sometimes don't take into consideration people of color, poor people, and so forth, is why quarantine is a privilege. So with respect to the Latino community, only 16% of Latinos can actually work from home. So when you have a small percentage of your population that can only work from home, that's a privilege. And a lot of that has to do with a lot of the jobs that folks in our community have, and addressing some of those disparities that Dr. Washington brought up at the very beginning about transportation, about jobs, about access to your social services, your environment that you live in. A lot of those play out, okay, right now in how people are able to protect themselves, stay safe with respect to COVID. When you're able to go ahead and quarantine yourself, you basically have the privilege of isolating yourself and exposing yourself to whichever degree that you want to. And when you have that privilege, that's a huge privilege. When you have to get up and go to work because you have to go ahead and earn money, you're having to take that to public transportation, you're having to expose yourself to other workers. That is a huge privilege to be able to have. So what's been interesting to see with COVID, okay, is how a lot of these systems that have been put in place, and a lot of times not taking into consideration people of color, poor people, how they're playing out with COVID is really about how people can go ahead and have access, no access to health, to other services, to keeping your job, to not keeping your job, to providing the education to your children, not being able to go ahead and to provide that. So a lot of that is playing out right now, I think, as we see within COVID. So that privilege is just coming out in many different ways. Another example of that is with the undocumented population, okay? So with undocumented folks, a lot of those systems and structures, such as not being able to access any federal programs, whether that be food programs, health programs, or other programs, you are not able to go ahead and access them. With respect to stimulus, because they're probably working under the table or through other means, they're not able to go ahead and access other financial resources that are available to other folks. And so, I mean, and I can go ahead and describe other things as well. But I want to bring up something also that Dr. Sampson said, which is really key, and I think sometimes we forget about these when we're talking about structures, whether they be racial structures that are in place and so forth. And that's one key thing that she mentioned, which was empathy. The empathy piece is really critical when we're looking at developing systems, policies, structures. A lot of times people who are creating those systems, those policies, those laws, and are not doing it with empathy with respect to people of color or poor people, are creating systems by where these people don't really have the access to participate in those structures or their systems. And I think that as we look at racism right now, and we're looking about how racism plays out institutionally through structures, through systems, through policies, is also building our awareness of having empathy, so that as we're looking to rebuild them, as Denise Myers was talking about what's happening right now at the legislative piece, and bringing more people from the community in, is what is needed as we look at relooking at these systems and rebuilding the systems, these policies, these laws, so that more folks have access to them, and that we're really creating them differently as we move forward.
Yeah, that's helpful to hear, Carlos. Thank you for digging deep in there. There's some good questions in the chat feature that I want to start jumping into. One reference is that, Carlos, but I'm going to skip with your question. Did you want to ask that out loud, sir, or would you like me to?
Let me just give it a shot.
All right.
My thought as I was listening was the impact financially of COVID, especially on our disparate groups. And so politically, there's a conversation about what is it, Medicare for all. And my question is, how does Medicare and Medicaid or other programs, are there other programs that will help the individual pay for the impact of having the virus?
Thank you, Skip. Dr. Washington?
Well, I can say the financial impact of COVID is just now being realized by most folks. Not only getting access to health care and your COVID bills paid for, most hospitals that I'm aware of and most hospital systems will not charge for COVID related issues. But that's not your question. Your question is, when are we going to have a system of care in this country that will pay for pandemics or preventative care for that matter? So I think you're asking an extremely important question, but specifically for COVID, the testing is free. And even though people are admitted and stay in the hospital for weeks or months, most of that is being covered one way or another. So people aren't going to have to become bankrupt because they've had COVID. But that's not your question, I think. Your question is, how are we going to realize a healthcare system in this country that is fair for everybody? So I think that still has a lot of work to be done.
Thank you. And the first answer about the individual's relationship to the hospitals was really a part of my question as well. The broader question, I think, will have to be answered in a political context. But I'm hopeful that these disparities will give initiative to finding solutions that will bring everybody into the healthcare system and then find ways to pay for treatments like for COVID.
That's great. Thank you, Skip. Thank you, Dr. Washington. This next question I'm seeing is from Dan Lewis, and maybe for Carlos, maybe you want to address somebody specifically, but Dan, do you want to ask that?
Thank you. What an honor to have a chance to ask a question of this amazing panel. And it struck me while you were talking, I've heard a lot of conversations about essential workers. And what I can't figure out is how they suddenly became essential when this crisis hit. And we know that a lot of those folks are people of color who are being put in harm's way and asked to perform, their tasks on behalf of the rest of us. And yet we haven't done anything in particular to protect them or help them. Or maybe you have, maybe some of you know something that we've done. So my question is around essential workers. Have we done anything to help protect that group of very important, very valuable people to our community? And do you think maybe, I mean, I don't see these folks becoming less essential once we get beyond this crisis. They were always essential. Do you think this might strike a bit of, and put some energy behind focusing on taking care of our essential workers going forward?
This is Dr. Washington. Let me take a stab at what in the medical community we describe or interpret as being essential. And that is someone who can't, as Carlos said, stay at home. If you have a job, particularly in the service industry, where you cannot say, I'll see you in 5 months, I'm going to work at home and do all my job on the internet, that in this context is what essential means. And so if you have to go to work because you can't work at home, you have to take public transportation, you have to work in a supermarket, those are, in this sense, are essential employees. Now, the other part of your question is, have we as a society done an adequate job of protecting them? And I would say, in most cases, we have not. That is why there are outbreaks in meatpacking plants, in supermarkets, in public transportation, bus drivers, etc. We haven't done near a good enough job of protecting them. And yes, they're essential, but they're only essential because they can't work at home in this context.
I was going to add, if I may.
Absolutely.
Is it all right
Carlos,
if
I see you too, please.
Sorry, yeah, because I think that's an important question, Dan. I think, like, our government leaders like to tout these particular workers as quote unquote heroes, but actually the truth is much darker. These are the individuals that I mentioned earlier, right? The grocery store worker, the one who's stocking the shelves, et cetera, woefully underpaid, historically underappreciated, and now we are now putting them or asking them to sacrifice themselves, for the average of $12 an hour, so that more affluent people, most who skew white, can stay at home and safely shelter at home and shelter in place. And that goes to what Carlos was talking about later, about who can work remotely and who can't. I think that there's this is one of those things where we now have this intersection of the state doesn't have any money and we have the greatest needs to provide these, institutional safety guards and safety nets. And it's because we've ignored that for so long. And now when we really need it in a crisis, we don't have it. And at some point we have to change those priorities. I mean, part of what a lot of the things that came out of the equity committee were a lot of these, frankly, very expensive, but great and needed ideas. And that's the question, is how do we now provide those safety nets in a way that we disregarded and didn't think we needed to? And we're too late, but we got to catch up.
I think also within these essential workers comes a big piece about the industries and the lobbyists they have behind them. It was really interesting to see when our mayor here in Denver didn't consider having liquor stores and cannabis stores open, and within 2 hours, that completely was overturned.
Was it even 2 hours? Was it even 2 hours?
Maybe not. Okay.
I've seen the T-shirts that say "I've survived the Denver prohibition."
Of 3 hours, right?
Exactly.
Something like that, yeah.
And
From 4
Dr.
to 5
Washington
p.m.
brought in the meatpacking workers. I have 5 cousins who work in a meatpacking plant. 4 of them which got COVID, and 2 of them before they closed the plant, and 3 of them after that. They supposedly cleaned the plant up and everything was fine. And yet you had the unions who weren't even protecting the workers because it was important to make sure that everybody had meat on their table tomorrow, the following day, etc. Going back to what Denise was saying. So a lot of this also becomes to be very political about, what we have, what we need, and so forth. And until we really address what are the values of our society and how we carry out those values is a big piece around this.
I just
Oh, what
want
a
to
great
add,
question.
I
I'm
want
sorry?
to add that
Yeah,
I
please.
like what Carla said about who do we value. Just placing the essential title on people's head is a very disgusting place to start with in terms of the value. And so I really want to talk about that. I saw a group of bus drivers, probably a third Black and brown in Detroit, talk about we weren't essential before. We didn't receive masks, we didn't receive care. And if we're going to talk about this long term, we really have to think about the policy issue. When wanting to change this whole world, why are these people making so little money? Why, if they're so essential, why haven't we cared for them, been respectful, provided them opportunities, safety, and support? And so I want to look long term, what is essential going to mean? We all should be essential, but there are people who hold us up and anchor us every day that we never thought were essential before. So what's the value of the people that we find essential now, who have always been essential to this economy? So that's my greater thinking about it, is that what's the value of life in terms of the people that serve us, so that I can be able to stay home, social distancing, other people can be able to. They provided for us, and what has been a high cost.
And what that looks like is so important, right? And how we do that and what role we each play. And you know, I will ask before this is over what we can do as a leadership community. So wait for that piece. I do want to get to a question from Dr. Garcia. Before I open that up to you, Dr. Garcia, you know, we have 5 or 6 questions come from other participants who emailed them in prior to those that are on the call. If we don't have time for that, I will ask maybe that our speakers allow us a chance to email you the questions and we can respond to those in our follow-up, because we have a lot of great questions coming in. Dr. Garcia, though, the floor is yours to ask your question.
Thank you so much. I really want to thank Dr. Sampson for her perspective and really opening the conversation to the more social aspect, and to really looking at racialized structuralization and how that has really impacted what is happening right now with COVID. When we think about essential workers and when we think about those people, we already know who we're talking about. It's coded language. And I think it's very important to label that and name that. We know we're talking about people of color. When we know that 86% of people who cannot stay home are people of color, when we talk about them as essential workers, we know exactly who we're talking about, and I think it's more important that we start naming them. That's where we're going to start to get respect for them. On that, I think I'm very disturbed at the way we've romanticized COVID and what's available to people health-wise. When we say that everyone can have treatment for free, everyone can come, I think that is a romanticization. We all know that in the medical community, there exists a huge bias to people of color and the pain that people of color experience. We can see it in the opioid issue, why it's so small amongst people of color, because people of color's pain was not taken seriously. Many people during COVID right now have been turned away, whether they are Black, Latino, or otherwise, people of color, and not believe that their symptoms are good enough to be tested. So when I have that, I guess, that looming question for all of us, when we talk about everybody can be tested and it's free for everybody, who are we really talking about that it's free for, and who really has the access to it? And to really be very honest and open in naming that, because we can continue to talk about statistics. Statistics don't change behavior. Statistics inform. It's the empathy that Dr. Sampson is talking about that actually speaks to that part of the brain that creates a synapse for empathy to change behavior. And when we think about compounded oppression, when we talk to our white counterparts who really understand compounded interest, right? And we talk about wealth, we need to start talking to them about compounded oppression and understanding the effects of that. And I close that with thinking about what are we doing to regulate to see that people of color are receiving adequate and equitable treatment when it comes to COVID in the medical field? Because we all know that good policy is not for it's for people who can afford it, not people who need it. right? There's not enough people who can afford to go and lobby and fight for these things for the people of color to be adequately treated. So thank you, Dr. Sampson, really for bringing that part up, as a racialized structurization is something that we need to talk about more than things are free for everybody, because they're not free for everybody.
This is Dr. Washington. I don't disagree with anything you said, but I think you misunderstood my answer to the question. The question is anybody going to get a large, at least my interpretation of the question was, is anybody going to get a large bill because they received COVID treatment? And the answer to that question, I think, is very specifically no. I think if you are in the healthcare system with COVID treatments, you're not going to get a bankrupt bill because you have to pay for that. And free testing is available for people who want to go get tested. I'm not aware of any case where someone said, we're not going to test you because you don't have COVID. That was true initially for everybody, but now anybody who wants a test can receive a test for free. That's a different question than what you're bringing up, which is a very valid point about who wants and how do you get access to the system. That wasn't my answer to the question that I interpreted was the question. So I apologize for any misinterpretation you have of what I said.
Oh, no, I don't think it was a misinterpretation. I think when we talk about it, if you look at the media outsource, and I really, Dr. Washington, it wasn't pointed to you, and I'm sorry that you felt it was, but when you think about the media and how we're primed to hear this over and over, that it's open to everybody, it's a romanticization that's not a reality.
Absolutely.
That's great. I love the point that came up there. Again, we had some wonderful questions from folks initially. I will assure you that I will try to get answers to your questions from Cindy, Renee, Jackie, Brad, and Helen. I will work to get those. As we look to wrap this call up, which has just been full, I wish we could do another hour of this. I'm sure y'all on the phone don't because you have other things to do. But I want to end with a question that's really important, and we ask this on every Virtual Voice, is what can we do as a leadership community to help? And I want to start with you, Darlene. Dr. Sampson, what can we do to help?
Well, we need another hour, okay?
Yes, we need one a day.
I want to push again that we've got to go close to what we're really talking about. We cannot use all of these other umbrella terms and behaviors that don't really talk about the issue. We've got to talk about oppression and racism. We've got to talk about how people present in office, health centers and offices, and don't have respect and care, and that we talk over and don't listen to them, and we don't really want to know what their life is really like. And I want us to stop blaming people for the health inequities that are social ills, because they are social ills that create some of these issues. And then we want to examine and modify accessibility from the beginning to end. If we're going to really look closely at our systems and dismantle them and make them better for everyone, we want to look closely at what it is that we need to do and how do people present and what do they get. Empathy, so important. How we listen and how we care about the people that come. And we want to fund local sources of health and partnership in our communities. People shouldn't have to go far. They should be able to go down the street. They should be able to go to their church. We want to bring our healthcare systems closer to communities so that we develop trust. There's a lot of mistrust out there about even accessing healthcare. It's in every setting, education, economics, everywhere. But while we're focusing on health, we've got to look broadly at what we have done to create some of these spaces where people don't get their needs met and they don't trust the system.
Great, thank you, Denise.
Oh, wow. Okay. I'll try to be quick, and this will be a little bit of surprise because I'm actually going to pivot to something that hasn't been talked about, and it all really has to do with the race and ethnic injustices. The race and ethnic inequities of this virus could not be more profound than in our jails and prisons and detention facilities. Those particular areas are a virus's delight. There are individuals in prison where they are 2 or 3 to a cell. There is no such thing as social distancing, and there are no such thing as everyone's wearing a mask. That couldn't be more true at the Aurora Detention Facility, which is a privately owned facility by the GEO Group that operates in a shroud of secrecy. We have no idea what goes on in that facility on a day-to-day basis. the largest facility in the state of Colorado with the greatest number of confirmed virus cases is the Sterling Correctional Facility, with over 500 individuals having tested positive. And again, it should be of no surprise to anyone on this call that Colorado, just like any other state in our nation, incarcerates more people than it really needs to, and it disproportionately impacts our communities of color. And that's just wrong. And it's also wrong that we have individuals there that are 85 years old, that have aged out of crime, they're vulnerable to the virus, they have a home to go to, they're Black, they're brown, and they were the subject of sentencing disparities that have plagued our criminal legal system for decades. And so I don't want anybody to, I don't want people on this call to forget those people. I really do welcome each and every one of you to go to our website, which is aclu-co.org. And we have a page that's called Doing Our Part, Colorado. And you will find everything that you can do to push the governor, the Department of Corrections, your local sheriff, your local district attorney, to stop over incarceration, release people who are parole eligible, who have a home to go to, aged out of crime, vulnerable to the virus, and more importantly, do not present a safety risk to any one of us or any of our neighbors. And please don't forget our immigrant family and friends who really don't need to be in a detention facility simply because they're here in this country in violation of civil immigration laws. Thank you.
Thank you, Denise. I just watched the documentary on Netflix called 13th, and it really opened my eyes to mass incarceration, and it's just history repeating itself in a different way as regards to slavery. So I certainly stand with you on that, and I'll do everything I can. Thank you for that. Carlos, what can we do to help?
I would say build your awareness and understanding of the social and health disparities and on racism. Then share your new knowledge, okay, with others, with your family members, with your coworkers, share your new knowledge. Then thirdly, act on that new knowledge. How can you go ahead and bring that new knowledge into the workplace? How can you bring it into your children's school? How can you go ahead and talk about it in your neighborhoods? And I think the thing is, we need to act. We just can't go ahead and just have understanding and have more knowledge. And there's ways that we can act that sometimes we don't think we can. Like I said, on the workplace, within your children's school, within your neighborhood, look at the social structures that you belong to and be able to go ahead and use those as a way to start having dialogue and discussion and be able to go deeper in those discussions.
I love it, Carlos. Thank you. Dr. Washington, what can we do?
Thank you. First of all, thank you everybody on the panel and for the audience. I think this has been very helpful, and we could use more hours of this, obviously. I think COVID has done an excellent job of exposing all these issues. My only hope is that when COVID finally gets contained, which I personally believe will take over a year, that we don't lose the lessons that we've learned. The social determinants of health are so important. And I personally believe they start with education, the prevention of the social determinants of health. They're so interrelated, but I think a lot of them are based on the basic education. And if we can't offer our youth very early education, that's going to continue to be a problem. Denise, you bring up the prisons. There's a lot of data now being amassed about how important that is. In Chicago, for example, if you go to one of the jails in Chicago, even briefly, you're more than likely going to leave with COVID. That's very disturbing. I think we have to do more about asking various communities, how can we help, rather than telling them how we can help. Ebola taught us that. We know that Ebola is extremely contagious, particularly around the funerals that these individuals have in those countries. Yet what people did is went in and said, you can't have funerals anymore, rather than try to understand the cultural reason why they have funerals. And so those people who came in to help were actually killed. And we have trouble understanding that. But that happened in this country where, in the South, where the National Guard was sent into communities to get testing for COVID. And because of the distrust that everybody's talked about, that clearly didn't work. Once again, we need to ask, not tell. But I think we have a lot of work to do, and I think COVID has exposed a lot of these opportunities. And I just hope when COVID goes away, this enthusiasm doesn't go away.
Okay, I think we've all agreed that we're going to stay on for another 3 hours to continue this. Boy, would I love to. Wow. Denise, Darlene, Carlos, Reggie, thank you so much for your time. This has been tremendous. I do wish we could do more of these. I will ask a favor of all the attendees on the line. I'd love to hear in the chat feature just a 1 or 2 word about how you're feeling, what you got from this. Type freely, type honestly. We want to know what you're feeling, what you're learning from this. I think a big theme we've heard is how important education around all of these issues is going to be. We will send out information and a recap of all of this, so you can look forward to that. A few things to remind you of: we have been recording this session, so we'll send that out as well. Our next virtual voice is coming up on June 15th, and that is about the importance of storytelling and really just where storytelling has a role in all of this, COVID related specifically, but also now in our fight against racial justice. So join us for that one. We also have one about community collaboration and where the importance of that is coming up. You can register on our website, and we hope to see you on that. Finally, I'd love to just let you know we are continuing on with our programs. We do leadership programming, and it's so important. It's more important now than ever that we have a community of leaders that is willing to educate themselves, willing to stand up and take action where needed. We do quite a bit of this at our work. We're always doing better internally and finding ways that we can help opportunities like this succeed. So we hope that you guys, as our best voices, our best advocates, will go out and recruit. Application deadlines you can see on the screen. We'll also send this out, but we hope to see your faces and others in one of our programs. And again, I want to thank our speakers. You have been tremendous. Thank you to all of our guests on the virtual voices today. Thank you all so much. We'll see you soon. Cheers from my living room.